Technical people, can I have the green light? Green light? Thank you very much. Good afternoon, everyone, or good morning or good evening, because this event will be on streaming. So make sure you look nice and don't relax too much, because you will be on a permanent camera, so everybody can see you. Thank you very much for joining us. My name is Maria Neira. I'm the Lucky Director of the Department of Environment, Climate Change and Health, and very happy to have the opportunity to organize this event today. The reason why, for those of you who are new in this room, the reason why we have those lungs, this fantastic sculpture behind us, is to remind everyone that climate change is very much about health, the health of the people, the health of our lungs. These represent our bronchia, and believe me, we need our bronchia. If we stop breathing for even less than 2 minutes, you will be on such an incredible anxiety that you will have a heart attack immediately. So we want to remind everyone the importance of our lungs, the importance of being able to breathe air that is not so polluted. And one of the best ways to have non-polluted air will be to move very quickly to renewable sources of energy, to clean sources of energy. I work for the World Health Organization, believe me, but sometimes I work for Irina, Francesco, because I am promoting renewable energy so much that I could be working for an agency promoting renewable energy. We are very happy to have this panel today. For those of you who wanted to ignore the external noise, maybe you can ask for earphones. We have earphones, and that will facilitate you, because it's very noisy and everybody is very excited outside. We will have 4 incredible participants, and you will agree with me, because the 4 of them are representing very specific experiences or organizations, and I think you will get the message here. The message for us is energizing health. Health is very dependent on sources of energy. Even if we are on a very remote healthcare facility, we still need electricity. We need electricity to operate a simple refrigerator to keep a vaccine. We need electricity to maintain some of the oxygen that we need, is oxygen concentrator. Any of the health services that we can provide will require electricity. And for that, at the moment, unfortunately, a big percentage of healthcare facilities around the world, and particularly in Sub-Saharan Africa, they do not have access to electricity. So we want those healthcare facilities to be the place where you can provide health to people and support them, and having water, sanitation, and electricity. And for that, you will hear more about the possibility of gaining those healthcare facilities access to electricity without contributing to the carbon footprint, and at the same time being less reliant on the fossil fuels like diesel, which is very expensive. And you will hear how this is becoming possible because the prices are getting down, the prices of the renewable energy, solar energies are coming down. You will hear from very, very concrete examples to the global picture. So let me start with Francesco La Camera. Let me start with Francesco La Camera. Francesco La Camera is the Director General of the International Renewable Energy Agency, IRENA, for most of you. And we have been cooperating very much on how important for us the health sector will be access to the renewable energy. So my question to you, Francesco, if I suppose I can call you Francesco. We are friends for a long time now, so I suppose all of you will allow me to call you by name. Or representatives, and we have gender little imbalance, but don't worry, I will cover that part of the gender issue Don't worry, I will make sure that it will look that there are 4 women here. Francesco, la camera. What's the point of view of IRENA? You are the leader of IRENA. What is your role, the role of your agency on this renewable energy for accelerating the electrification of the healthcare facilities? So you have a key role here, a leading role. How are you helping us on this role to electrify healthcare facilities?
So first of all, thanks for inviting IRENA to be part of this discussion, and thanks to you, Maria, in particular. The beauty of knowing the questions before you come is that you can read the answer. So it makes much more easier for us to respond effectively. Anyway, we really can say, as Maria has anticipated, that the energy access is naturally one of the areas where the agency is spending most of its attention. And naturally linking with the World Health Organization, the health energy nexus is critical. There are still around 1 billion people relying on healthcare facilities with either an uninterrupted electricity supply or no supply at all. Renewable energy can play a transformative role in accelerating energy access. Therefore, IRENA has conducted several in-country assessments of the electrification need and access barrier to healthcare facilities around the world. I think this is one of the work that has been more qualifying the collaboration that we have with the Geneva office. Such as assessment has been completed for Burkina Faso and now going for Sao Tome and Principe, Mali and Mozambique. And once these are complete, the agency plans to expand the work in other countries. IRENA is part of a number of partnerships and global platforms, including the Health and Energy Platform on Action. That is an important multi-stakeholder initiative led by the World Health Organization. In view of the COP28, we aim to create a partnership with government, philanthropies, foundations, trusts, charitable funds, the World Bank, and the private sector, among other stakeholders, and naturally the WHO, to commit $1 billion towards the empowering lives and livelihoods, renewables for adaptation, an initiative to connect people and livelihoods through renewable energy solutions in agri-food and health sectors. And I think that next year we'll have a lot of room for getting space in this area. The link between energy and health has never been more important than today. And we are together to stand and work in this area.
Francesco, you say 1 billion? Did I hear that right?
Un miliardo.
Yeah. Wow. No, I wanted to just to make sure that I heard properly something which sounds very, very positive. Thank you very much, Francesco, for describing key initiatives of IRENA and telling us how much you are ready to help us on electrify healthcare facilities and how much we are ready to promote the use and access to renewable energy. We're privileged to have as well the Vice President of the World Bank. We have with us Mr. Riccardo Puliti, and he's the Vice President for Infrastructure. You know, the World Bank is a key actor on electrification of rural areas. So you are including, of course, public institutions. I hope that the health sector will be there as well. So we wanted to hear more from you on what are your plans, how are you supporting us, how much health is included in all of your projects. Oh, Ricardo, over to you.
Maria, thank you very much. Good afternoon to everybody. And I can assure you that Maria will lead this session, so the gender parity is assured. My wife is Spanish as well, and I'm well organized, believe me. So I make very little decisions. But having said that, I think we have to look at the at the issue of electrifying health centers and clinic in the global issue of global electrification. At the moment, there are around 730 million people around the globe that do not have access to electricity. Regrettably, I'm afraid to tell you that due to demographics and due to the pandemics and other multiple crises that we see, we think that in 2 years we will have 930 million people. So we are going back instead of going forward, notwithstanding all kind of efforts, as Francesco was saying 1 minute ago. That doesn't mean that we are going to give up. It just means that we have to work more. That's the work we have to do. I have to financing, but also knowledge. And I have to tell you that approximately 1 billion people do not have access to health facilities that are electrified. Then you think about yourself, how bad is it? We are 8 billion in the world, 1 billion don't have access to health facility with electricity. So it is certainly something we have to improve. We provide financing, of course, and we have at the moment our portfolio. So the portfolio is like a picture, no? What we have at the moment. We have $250 million in health facilities, 7,000 health facilities around the world, mainly in sub-Saharan Africa that received this money. Think about it. We do around 1.4 billion of energy access every year, but probably no more than 100 of these go to health facilities. So a lot of work to be done in that. The other thing that we do that is very, very important is provide knowledge. Because when you make decisions, I have to confess, I'm a banker. So nobody's perfect. So don't trust me, maybe, I don't know. But you need a lot of knowledge to make the right decisions. It's like a doctor. A doctor will never operate a person without having a very clear clinical examination of what is going on. So during COVID-19, we work very much with all the countries where we work to provide them with plans on how to rapidly deploy solar hybrid system to electrifying health and public institutions in general. We provided also an analytical tool to estimate what were the energy requirements of a health facility. And last but not least, we provide also a tool, an analytical tool, in order to make sure that the vaccine cold chains, as Maria was saying a few minutes ago, were properly electrified. And in addition, we have now another study which is called mini grids for 500 million people. A mini grid is a decentralized energy facility, but it's bigger than what you have in your home. It's, let's say, the same thing that you have for your home, but for, say, 100 homes. That's why it's mini. And the idea is to provide mini grids for 500 million people and 100,000 health facilities by 2030. So we plan to triple our 1.2 billion per year in order to achieve that. So I don't want to say it's easy, because it is not, and I'm not going to lie. But I mean, there is a lot of things that we are certainly doing. And I would like to finish to say that solar panels by itself are not enough, because they will give you the electricity while the sun is up. You need batteries in order to accumulate the energy during the night. So during this meeting today, whenever I say solar or renewables, I always mean solar plus or renewables plus batteries. This is very important. I stop here. Thank you.
Thank you, Ricardo. Thank you. Thank you. Yeah. Thank you, Ricardo. This is a very interesting way to start the conversation. Of course, we need to have a look at the whole equipment and what that means at the field level. And I know that some people will say this is not easy to implement, and therefore, to talk about that, I'm very lucky to have here with us Dr. Malik. He's my colleague. He is working with WHO, but at the country level. He's our WHO representative for healthcare facilities in Somalia, and what's happened there. Tell us what you did.
Thank you, Maria. I think that the most important thing is to understand why people in Somalia continue to suffer since this war has started in this country. There has been no single investment in electricity and energy sector. So what it means, the private sector is regulating the entire country. Do you know what is the electricity cost of Somalia? It can be $1 to $2 per 1 kilowatt. If you compare this price in the neighboring countries, it's 0.02 or 0.03. The access to energy in this country is only 15%, meaning that only 15% of the people in Somalia have access to energy. The country is spending 121,000 liters of fossil fuel every day. Forget about this picture. Come to the health facilities. Only 28% of the health centers in Somalia have access to electricity. Only 27% of the people can access healthcare. It's not the fault of the people in Somalia. It is because we have not invested in a proper way. Now let me give you some few facts. I have visited many health centers in Somalia. I have been saddened to see healthcare workers are doing surgery using kerosene lamp. Under candlelight, pediatric emergencies are being done. This is an example of social injustice. We cannot continue to do so. Do you know that the lifetime risk of death to a woman in Somalia is 1 in 22 from maternal related causes? A child who is born today is 16.5 times more likely to die before the child reaches the age of 5. This is not because of the fault of this woman or child, because we don't have health facilities which can provide health services. We don't have refrigerator to preserve the vaccines, and 1 in 7 child in Somalia is missing out of these life-saving vaccines. It is close to our heart that we need to reverse this situation. What we are planning to solarize health facilities. Do you know why? The reason is Somalia is, the land mass is vastly arid and semi-arid. Do you know how much sunlight the country enjoys? 8.73 hours of sunlight every day. There cannot be a suitable, more appropriate country than Somalia to have solar power. Now we are solarizing health facilities in Somalia, and we see 5 benefits. Number 1, access to healthcare will be improved because people are not receiving services, because health facilities are not functioning, because there are no uninterrupted supply of electricity. The quality of care will improve because pediatric emergencies, emergency obstetric care, all can be taken care of. Third thing, what we feel, cost saving. A health facility or a laboratory, give me an example, spends 8 to 10,000 US dollar to pay the electricity bill. Similarly, if it is a solarized, they're going to pay only $30 just to maintain the electricity line. But the electricity will be free. It will be coming from the gift of the God. Last thing, resilient. And in one of the study done by UNDP, not peer reviewed, we have seen there will be 100% rate of return during the lifetime of this solar system because of cost savings, but because of also reduction in pharmaceutical waste because of the temperature control. And think about the efficiency gain that we will have because the services will be delivered optimally. That's the reason we are doing solarization of health facilities in Somalia. If we can win there, I think we can win everywhere.
Thank you so much. You know, when you work on public health, you cannot talk exclusively about diseases, about what's happening in the hospitals and in the clinics. You need to understand as well what can we do to prevent all of those problems we are having. And one of the issues we are having is this lack of access to electricity and water and sanitation in most of the cases. So some people will start, like my colleague Dr. Malik, to have all of these figures about energy, about batteries, that we didn't learn that in our medical schools, but now if we want to do public health, we need to raise our voice on the energy sector, and this is exactly what we are doing. So this is starting to get very interesting now. So my question to you, I mean, the next participant is Arish. He is the head of Selco Foundation. Selco Foundation has been providing electricity to thousands of healthcare facilities in rural areas. They know the technologies. The prices apparently are going down. You heard the data from Dr. Malik. My question to you, Aris, why is this not happening? I mean, when you have such a logic arguments, common sense, when you have prices talking, when you are talking and everybody's saying here that there are financial problems, why we don't use our common sense as one of the best investment and the most probably profitable one? Aris, is that a complicated question? Over to you.
But you said common sense.
Good sense.
No, I said common sense. That's missing. Surely, because I feel it's very hypocritical. Giving a very simple example, money is there. It's just the willpower is not there. Frankly speaking, people speak. Willpower, just a small thing, like with IKEA, for example, IKEA Foundation, Jeff is here. We're doing a program of 25,000 healthcare and being a very, very small organization, we have taken up this one to do 25,000 healthcare systems in the next 4 years. And so 12,000 systems cost $45 million. 12,000 systems costs 40.
We need to digest that. Say it
So 12,000 systems, healthcare systems, needs $45 million. That is the equivalent severance package that Twitter head got when he got fired. Right? So if 20 CEOs got fired, whole of India can be solar powered. Okay?
Let's start.
Wait. Only 20 CEOs getting fired, right?
Okay.
Last year, Uber's loss would cover Latin America, Africa, and India completely solar powered, $1.6 billion. One company and 20 CEOs, if they get fired, whole of the world can be solar powered. So money exists. Is there willpower? And what are we talking of economics? I mean, today when people say, unfortunately, I also hear this language that private capital will come and help it. Today, if you see the BBC News saying that that 4 or 5 people are requesting the Prime Minister of UK to provide free lunch to every kid because non-hungry kids will lead to a profitable nation. Unhealthy people will lead to a loss-making nations like Somalia. We are actually creating and seeing the wrong type of Excel sheets. The only thing that is lacking, it's not common sense, it's the willpower. Money exists, and we need to look at public monies to look at these systems. And if a very small organization like Selco with 150 employees has taken a pledge to do 25,000 with IKEA Foundation, the other institutions should do 20 times more. And by 2026, we should stop talking of solarizing of health. He needs 100 systems, which is just $3.5 million. I mean, it exists. Maria, I don't know what to say. I think we have analyzed enough. I don't think so we should talk about economics. Economics against a human life, it's crazy. If he's talking of number of maternal deaths, still in the 21st century, it's really, I mean, it's a different. The Ukraine war itself could have electrified. My question is, it's the priorities are completely missing. If all of us together on this table got together, we could electrify the world in 4 years.
Okay, done. If it's me, I will come for it. Okay, nobody wants to leave the room now, huh? It's getting really, really interesting. Okay, I have a nice information for all of you. We are very lucky to be joined, and we have seated here the Minister of State, Federal Minister of Power from Nigeria, a very small country, maybe, 1,000 in a... I'm joking, Minister. You are one of the biggest, you're a continent. Come on. I wanted to make sure that you were here and you will be listening what I was saying, and I see this is the case. Minister, can I put you on the spot? Do you want to say something? Okay.
I don't know the protocol here, but permit me to carry on without protocols. I first want to say she's a very nice lady. She talked about my country very glowingly. We're the biggest country in the world, the best country in the world. All the power is in our hands, and we have light everywhere. It's gladdening to be in the midst of all of us today. I missed most of it, but what I had made me happy. If he says 6 of you, 4 minutes can light the world. I'm a happy man if that can happen here right now and today. And I know it can happen if we have a common will. If we have the will to do it, it's going to happen. If we wish to do something and we decide that we want to do it and we have the power to do it, it's going to happen. So I hope at the end of this day, end of this conference, end of COP27, we should be able to have positive steps towards what we want to achieve climate-wise. Thank you.
Thank you so much. Don't leave. You have to stay. And if a small country like you can do it, okay, you are a continent. You are almost a continent. Nigeria is one of the biggest countries in the world. So that's why we are so happy to have you here, because if you could electrify with solar panels Nigerian healthcare facility, then this coalition will be one of the most powerful ones. You heard the perspective. You have a country with enormous difficulties, but where things can be done. You have the World Bank, who is ready to invest on an incredible way. You have a Selco Foundation, who are telling us very common sense things, and where the political power is missing and how we need to structure on a more strategic way. And you have Francesco La Camera from IRENA. Francesco, let me go back to you now. What are the key needs that you think IRENA needs to put in place in order to accelerate this access to solar panels, electrification of the healthcare facilities? I'm sure you have...
So it's a simple but also a complex question to respond. Just if we look to the health sector, to our study that we recently published on Burkina Faso, say that electrifying around 779 unelectrified and not functional health facility will require around 10 million US dollar. That is almost close to nothing. So we can, to say, insisting on the common sense argument and say how this is possible. The fact is this is happening. So we have to try to understand how renewables can be an engine not only for building a new energy system, but also an engine to ensure a less unequal world. So this is the point, because we cannot consider a sector isolated by others. The question that we have is how to ensure that going for a new energy system will ensure more development. And sometimes the focus should be in the development, and then how we can generate the energy that can sustain that development. And we say very clearly today in this round table on focusing on green hydrogen that we don't see chances to success if we don't rewrite the way the cooperation works. And now it is important, especially talking about Africa, that the first things to do, generally speaking, is working on the infrastructure. So naturally we can put solar panel on a health facility, in something that I did in Namibia 7 years ago when I was in Minister for the Environment. So we try to put some heating in air facilities that are 2,000 meters in, but it's just way to push, how to say una toppa, Riccardo, how to say una toppa, to put just a quick answer to a problem. Yeah, but to make a patch. The question is how to ensure that we build an energy system that is capable to offer services, because without that everything will be more difficult. So naturally we have to concentrate on solar, and I finally hope that on a healthcare facility, and I really hope that all this philanthropy that is rising around the world will take care of this problem. Put 10 million to solve at least this facility in Burkina Faso without discussing too much. That I'm also starting to be tired on this way to manage, this way to support our activity when there are things that can be done easily. And then there will be the ask of building a new narrative on the way cooperation should work. Infrastructure, that means physical, means legal, means that we have to work on industrial sector. What does it mean? It's ridiculous when we talk about Africa concerning mitigation. What does it mean, mitigation in Africa? So we have to see a cooperation that is working on the building the industrial sector. So building the society can really prosper and take the opportunity to have a better general manager managing over the facilities that are there. Naturally, we have our plan. Some could be very easily realized. But in our point of view, and what I ask you to let come out from this scope, that we have to rewrite how the cooperation works if we want to be successful in this continent.
Wow, and a small detail. Talking about cooperation and changing and partnership and this famous intersectorial, I need to ask the World Bank, Ricardo, what are the initiatives? How are you putting this intersectorial collaboration? What are you doing? I think you need to use this one. It's the only one.
Can you hear me?
Oh, yes.
Yeah. So intersectorial coordination. Intersectorial coordination is utterly basic. Because you see, 1 minute ago we said there are a lot of health facilities that don't have electricity, and that create really health crisis. Full agreement with that. But you know, many times there are also roads, especially in sub-Saharan Africa, that don't allow a sick person to get to the health clinic in time. So in the reality, we started with electrifying health clinics, but we have to see the issue altogether. We need all-weather roads, because especially in Africa, roads change depending on the weather, that can allow people to move. We need, of course, the electrification of the health and clinic. If I may say, colleagues, we need digitalization as well, because it is incredible to think that, you don't have access to many things. Now, what is the problem? Only in sub-Saharan Africa, around 52% of the population do not have access to electricity. So it becomes extremely difficult. And then there is a huge urban and rural divide. Usually cities have an electrification rate of 85%. And then we have Somalia. Can I tell you more? We have Central African Republic with 8% of the people who have electricity, and so on and so forth. So we have to work both on making sure that the cities get electricity, usually on grid, and then we develop as much as possible all kind of off-grid. And I repeat, with batteries. We must understand that solar plus batteries is competitive with anything we can think of. The years have passed. 5 years ago, solar and batteries was not competitive. It is competitive now. So now what I would like to tell you, we are really deploying as many financial resources as possible, and we do that. But the limit that you were talking about, you talk about will. It is will often. But please let me tell you, there are also vested interests that don't want certain kind of things to be done. There are also objective difficulties. In many of the countries where I work, there are wars, conflict. And the World Bank has built rural electricity in, for example, northern Nigeria, in, for example, southern Sudan, and actually $30 million in Somalia. So I'm sorry, but I would like to say that. So I want to say it is really going back to what Francesco was saying. Only by working all together, states, financial institutions like ARENA, WHO, which is incredibly important, civil society, to which I'm grateful, I want to tell you immediately. I think inclusion, governments, people, they all know that there is this problem. And this is different from 10, 12 years ago where it was mostly ignored. So I have to say, I have the strong feeling that we are going to overcome this by 2030, even though we are in the middle of a big crisis, we had a pandemic and all the rest, because at the end, the technology is there, the finance is there. There will be areas where it's objectively very difficult. But if we all put it together, which we do, for example, we do in Nigeria, on decentralized energy, this is very much feasible.
Thank you, Ricardo. Minister, you will allow me to again put you on the spot. How is Nigeria doing in terms of solar panels? I mean, how are you advancing, and particularly, are your healthcare facilities benefiting of this electrification with solar panel?
Thank you. I didn't look here when I first sat down. Now I can see. I can tell you very clearly that we have a program under the Rural Electrification Program where we are electrifying health facilities, public health centers, university teaching hospitals. We've energized 6 university centers, and the public, each zone. Nigeria is divided into 6 geopolitical zones. Each zone has had at least 2 projects of health facilities energized with solar panel finance in the past 2 years since COVID. And the program is still ongoing. We have funding from the World Bank. We have funding from other institutions as well. And so it's a program that's ongoing, and we are paying a lot of attention to health centers and health facilities in Nigeria. There are 6 zones in Nigeria, and each zone in Nigeria has a facility being cared for, and it's going on and on. For our rural communities, we have apart from energizing medical centers, we have provided solar panels to at least 1 million homes in the past 1 year. The president gave the directive, and that's been going. It's still an ongoing project. We have to electrify 6 million homes in 2 years. By the end of next year, we'll have done 6 million homes, hopefully, with funding from you, and we are grateful to that. And we must work together always. Thank you.
If we can electrify healthcare facilities in Nigeria, half of the world problem is solved. So now you are a big country, yes, so I'm now. Thank you. Okay, let's go back again to the implementation of all of this. And I'm wondering, Aris, take us again to the implementation. Still, you heard it, it's feasible, we need batteries, but we need as well to respond to the needs of our population. We are initiatives that are ongoing. How are we putting all of these streams together to make sure that, as you say, at the end of this meeting, at the end of the COP, we will be able to electrify the whole Africa healthcare facilities? What it will take? What are you proposing? What are we missing?
One thing is, Maria, I'll come back to the work with Irena. One thing that we are having this panel discussion in WHO itself is a big change, because number one, we would lose out an opportunity if we just look at that this is an issue of electrification. We would lose out on innovation of autoclaves. We would have lose out on baby warmers, suction pumps. This, for example, the health sector and energy sector, it's not about solar panels and batteries. It's not about the health sector. It's a combination of health sector and energy together. How can we go to GE? How can we go to Philips and saying that your baby warmer consumes 350 watts? Because it consumes 350 watts, your solar, we solar people are told it's expensive. You can actually design baby warmers for 150 watts. Dental chair. Why should a dental chair actually consume 1 kilowatt? I just need 5 features in rural Somalia where a dental chair can actually consume 120 watts, leading to changing of dental service in rural. See, how do we use solar to bring in building efficiency? How the PHCs are designed, maternal rooms are designed. Solar is used for redesigning the whole medical equipments to make it efficient. If we just solar power, we lose the whole innovation perspective. Innovative dental chairs then can be used in Harlem or in London. Health sector in Nigeria will showcase how the new health services in London or America can be done, because it will create a new set of technologies for which will consume less power, which is the biggest guzzler. I think we are losing these opportunities of the health energy working together. It's not about solar powering, and it's not about it's a combination of innovations that which will spur innovation, it will spur local enterprises, it will spur, and the most important, healthy citizens, leading to a profitable country. I think it can be done because entrepreneurial spirit is there, innovation spirit is there. We need to work together that it's not an energy problem, it's not a health problem, it's a nexus problem. And how do we bring innovation? Building design, efficiency of equipments, solar power, after sales delivery, and the overall ecosystem that is actually required. And this is what we did with Irina on the Burkina Faso. Nigeria, Burkina Faso, Mali, Sierra Leone, and Somalia. These 5 countries can show to London, New York, Washington, how healthcare services can be provided. That's what we should actually reverse.
I love this idea that Somalia, Nigeria, and Burkina Faso can tell London and New York how to do it. I love it. Let's keep on that. You have a dream. I know that you want to, you did some experience in Somalia with some healthcare facilities, but I know that you want to be very ambitious, and on public health, ambition is never big enough. So keep with your ambition and go for more. But tell us a little bit, what do you want to do next, and now that we are having this demonstration in Somalia? And if it can be done in Somalia, nobody will tell me that it cannot be done everywhere.
Thank you. We need to think big. We need to dream big, act big. Now, what we are doing, again, we are targeting primary healthcare centers in Somalia. Because, as my colleague and friend has said, it's not only solarizing the health facilities, how you design health services at primary healthcare level. We have seen the data. The Somalia has one of the highest maternal mortality ratio and infant mortality rate. 80% of these deaths can be prevented at the primary healthcare level. So if we have electrification in the health centers, primary healthcare centers, we can design that health services. So it's a benefit, public health benefit, which we often forget. Think about a situation, and I will ask these questions openly to you. Do you want any child to die from vaccine preventable diseases because there is no refrigerator in the health facility? Your answer is no. Do you want to see any woman dying because the woman was giving a birth under darkness? Your answer would be no. So these are the things which we should think differently, how we can go from one stage to another. Why we are thinking big? Because we have the experience of solarizing health facilities during the COVID-19, but the solar power was there only to provide oxygen to the patients. And we have seen 98% of the children who received this oxygen from this solar system have survived. Think about the added public health benefits. We have seen In those health facilities where we have set solar power, the healthcare utilization rate has gone up. The uptake of health services have gone up. These are the benefits which we often do not see. So we are targeting 100 health facilities to start with, to showcase, to demonstrate what changes it can bring in the health system. We think this is an answer to Somalia for building a climate resilient health system, because Somalia is one of the countries facing recurrent climatic events one after another. We have done an assessment, which is an energy assessment. I cannot talk about it, but Selco Foundation has done it. If we can run these 100 health facilities for the next 5 to 8 years, do you know the benefits of decarbonizing health system? It is going to decarbonize 20,000 to 23 tons of equivalent carbon dioxide emission in Somalia, only 100 health facilities. Think about the larger picture if we can go to a scale. Finally, I would say that if we can be successful in Somalia, there is no reason why we should not be successful. We can achieve 5 SDG goals. SDG goal 2, nutrition. SDG goal 3, health. SDG goal 7, which is energy. 11, climate change. 17, partnership. 1, investment. Too many wins. I'll stop here.
You forgot 13, climate change. No, it's fine, it's fine. But I have to say, you know, if you want to scale up, you have to learn the good lessons. Our colleagues from Nigeria, several years ago, established the Rural Electrification Agency. You remember, our friend Damilola was there years ago. Now she's a C for all. Actually, that's the right way to start. Having a clear strategy, embed electrification of rural areas, of health centers, etc., into national or regional plans. Because you see, electrifying 5 facilities, we can find the money. There is a lot of merit in that, a lot of merit, and I have a lot of admiration. But if you want to electrify a country where 50% of the people don't have electricity in rural areas, you need structures, institutional structures. And that was Nigeria did, establish the Rural Electrification Agency, and from there move on and electrify the country. So these are the important things.
I see Aris wanted to intervene. Aris, how do we do it?
No, see, yeah, so I was not talking of 5, I was talking of 25,000. So we are looking at 25,000 in 4 years, and I agree, 5, it's a time to look at, and with Irina, IKEA, we are looking at 25 by 2026. Next year, hopefully before the UAE COP, we should be there by 5,500 at 20 per day. We promised before we come to the COP. It's no commitment like the monies or standing in the line for food here, but we will be more efficient and in delivering 5,000 with these 3 partners by next year COP. That's 100%. And that's what my challenge to all of you is, that if a small organization Selco can promise by next year COP, we will do 5,500. By 2026, 25,000. Why can't we act? But the last point, Maria, is what Somalia can learn, what Somalia can teach us is, a lot of people say that we use solar power as a human resources. This is where we get the sophistication of telemedicine. Let's get that. Let's power a high quality TV and camera also in rural Somalia, where you can have a doctor in Houston or Delhi or London, practical. This is where decentralized energy leapfrogs innovation in many ways. So I think that's where we have an enormous opportunities. Francesca, you've been...
Thank you. I want to build on what has been said. So I think that Ricardo made very clear the need for established partnership is what this initiative that I have announced at the beginning is for. So this alliance that we want to build in the view of COP28. So trying to have an operational approach, okay? So we have a few countries where we provide with this assessment. It's a kind of emergency, let us say, a plan of emergency to put renewable power to some health facility. So try to build this and give us again in a way that is clear what has to be done for each of the 79 healthcare facilities that we have. And do this exercise for the 5 countries where we have already in advanced status, and try to do this, and then we continue. I will write a nice letter to all this philanthropy that are around all this COP, asking for the money. They say that they put billion, we need million here to give a quick response to this problem. In the meantime, try also to work on building idea for projects that can serve communities where the healthcare are also there. Try to be fast, because tomorrow we'll operationalize our energy transition accelerating financing. So that will be a way that we can use for a more structured response to the problem. I'm sure that with Ricardo we will find a way to cooperate in terms of technical assistance in first instance, and then on the structure, because we cannot ask the bank to fund a solar electrifying a plant, an hospital. We cannot ask that. So we have to use the philanthropy and then use the bank for the most structural intervention. Trying to be ready, trying to be fast if we can do it, and then we see if we don't get the response. If we don't get the response, we write to the newspaper, because I really like to get a little bit tired of this.
Well, it seems to me that we have an incredible plan here. You know, Nelson Mandela was the one who says, I had a dream. No, it was not a... Sorry. No. I said, sorry. Yeah, I corrected myself, said, no. So, Martin Luther King says, I had a dream. Here we are having a collective dream, but we are going even a little bit further. We have a dream, we have a plan of action, we have the donors, the implementers, the philanthropies, and clearly the commitment. What else? I mean, let's move to the COP28 with something that we will really demonstrate. For the health sector, this is fundamental. We cannot miss this opportunity. We are very happy that we put together with World Bank and of course Irina and UNDESA and others this high-level panel on health and energy, and this is bringing all of this capacity. We will be very happy to use this as the platform to accelerate and really increase the level of ambition on a fantastic way. I want to give now the floor to the room. If you want to take the floor, ask a question, challenging us a little bit more. Who wants to say anything? Yes, please. I need to pass you the microphone because I have the impression that only this one is working. So, yeah.
So, thank you so much for this interesting topic. It's just it's not a question, just to highlight something that there's many people used to use the traditional way of electrical power. So do you think we need more to promote about the solar? What's the positive of these things for the people to be used, like the energical or the solar energy? I mean, to promote the solar energy among the people to know how they use it and what's the positive things of the solar instead of the traditional thing like the generators and the other things. So thank you so much.
For some reason, only this one. You know, before passing to them, let me tell you that when I started my career as a very young doctor, I was in the evening going to assist a woman delivery with a kerosene lamp. And I'm afraid that was a few years ago, but I'm afraid today we are still going to some healthcare facilities in Africa, and this is the situation. You have to use a kerosene lamp or a diesel generator to assist, which is absolutely ridiculous. So, over to you, Ricardo.
It is ridiculous, but we have gone forward. And the governments and people in sub-Saharan Africa, above all, they do acknowledge and they do understand the real value of solar. You know, even when I was appointed global director for energy at the World Bank, we were still talking about lanterns. I don't know if you remember the lanterns. Nowadays, nobody talks about lanterns. Solar is so cheap, and also it's so implementable. To put a solar panel on a house or build a mini grid, a microgrid, is not difficult. And nowadays, also batteries are quite available. Let's be honest, and I speak as an engineer, albeit always work as a banker. It's not always easy. I mean, there are parts of Africa where there is dust and is irradiation, solar irradiation is important, but you have to take into account many things. But to answer the gentleman, I would say that nowadays all applications of solar are well understood. The well understood solar is in micro, mini grid and all the rest. Solar in grid, batteries in grid. So I would say that it's well understood. I would say that we have been stopped during 1 year by the pandemic, because let's be honest, during 1 year we have not been able to build anything, nothing whatsoever. The ports were closed, materials couldn't come, many people had to leave and go back to the city, to their family. That's why I keep this enthusiasm, because now that the pandemic is awfully behind us, I think we can accelerate really a lot.
Okay. Yes, please.
Thank you very much. I want to appreciate the contributions from all of you. I want to also talk and focus on Nigeria. Believe me, it's an exciting case, because what the Rural Electrification Agency has done in terms of penetration and the backing that the government had given, there's massive deployment of mini grids, off grids, all kinds across homes, facilities, and we'll see in the coming days what this would add to the energy mix in Nigeria. It's an exciting case for us. First, there has to be a backing. Government is committed, and in all of this, I will challenge the donor agencies and multilateral partners to be more sensitive and be more responsive. You're doing a lot, but we know that it's not only World Bank that is here. We know that there is AFD, there's AFDB, there is all of those. I don't want to say that globalization is major, and now that the West is fully globalized, we need to focus on Africa, and Africa needs this so that we can match neck to neck with everybody marching forward in the coming days. Thank you very much.
Thank you very much. And I have a question for you, actually. Yes, I mean, you represent one of the biggest countries in Africa and in the world. And we are talking about all the win-wins when you have solar energy and the price is going down, you reduce the carbon footprint, you reduce reliance on other fossil fuels. Why then is Africa not moving at a different speed, claiming and calling for more electrification with solar panel? I mean, do you see that trend on Africa saying, okay, we want to be independent and we want to have as a source of energy more solar, which is free. I mean, it's coming from something that we have on a daily basis. Is that a relevant question?
I'd like to answer on his behalf. He just said it. He said it as well. Africa is ready and willing to go. We came here last year, COP26 in Glasgow. They promised us 400 billion. We have not seen shishi. Shishi means nothing. You come here again, you are promising something, we see nothing. African economies are not very buoyant, like you know. We are struggling like others too. So donor agencies, World Bank, and all the commitments, put in the more money, you see what happens, especially in Nigeria. We didn't waste the money. Bring in the commitments. You've committed by word of mouth, but bring the action and see what happens by COP28. I challenge you to that.
I was kind of suspecting that answer, yes. Thank you very much. Yeah, there is a question.
Oui, merci. Moi, je voudrais remercier les panélistes. Je suis de la Guinée. Nous sommes invités à cette COP pour qu'ensemble la mise en œuvre soit possible. L'Afrique est confrontée à d'énormes défis en ce qui concerne l'électrification des structures de santé. Je crois que les panélistes...
Just 1 second, I will translate it because we don't have simultaneous translation, do we? No. No, elle représente la Guinée. She represents Guinea, and she says that they are here at COP just to accelerate this transition. They have been invited, but Africa is confronted with a lot of difficulties.
Voilà. Parmi ces difficultés, nous avons l'électrification des structures de santé. L'un des panélistes a parlé tout à l'heure là des décès élevés, en ce qui concerne les décès maternels et l'accès des enfants aux structures de santé. Cela est lié au fait que les structures de santé ne sont pas électrifiées. Et pour répondre à ce défi...
Wow. I'm not a professional, so you need to allow me to translate. I'm saying that among the difficulties they have in Africa is related to the maternal mortality, and they have a very high maternal mortality, and one of the reasons is because they don't have electricity on the healthcare facilities.
D'accord. Pour répondre à ces difficultés d'accès à l'électricité, 90% de nos structures de santé utilisent l'énergie fossile. Donc nous voudrions de cette COP-là, comment profiter de l'expérience des pays qui ont réussi la transition de l'électricité fossile à l'énergie solaire et aussi des mesures d'accompagnement. Merci.
Merci. Donc, she wants to take advantage of the experience of other countries on moving very quickly from fossil energy that she says in her country 90% of the healthcare facilities are using fossil energy, and they want to do this transition. So she wants to learn from other experiences. But this is the reason why we have created this HEPA group, the Health and Energy Platform for Action, and the leadership of all of the partners. So we will be in touch, and of course one of the purposes will be to share that experience. On va partager cette expérience, c'est sûr. Et on a créé une plateforme d'énergie et santé. Il y a beaucoup d'agences qui sont dedans. Donc on va vous contacter pour qu'on puisse partager cette expérience. Merci. Anybody else? Anyone who wants to react? Yeah, there is another last question. Yeah, thank you.
Hi, my name is Audrey. I have a question. So as a young pharmacist working in the front line, I'm wondering how you envisioned young health workers in the global north collaborating with those in the global south to come up with innovative and sustainable initiatives regarding to electricity access.
I think she was talking about what you were describing at the beginning, the efficiency, the importance of the efficiency, and she is a pharmacist, so I think it was more strengthening the point of the importance of the efficiency. On pharmacists, even more, they use plastics and they use a lot of, yeah. Thank you. You want to say something?
So were you speaking of the collaboration between the pharmacists in the global north with the people in global south? Is it what you're talking about? Yeah, I think we should use the power of technology now. I mean, even if when we went to rural Somalia, where it was 4G, we could easily have television sets, and I would recommend the case study of Arvind Eye Care. The way they look at Arvind Eye Care from remote The same analogy that we should do in Somalia and for the connection between the global north and the global south. Arvind Eye Care, who works out of South India, the same model can actually be replicated where the knowledge gets transferred in an. Oh, you can't hear?
Thank you so much. Let me have a look at my colleagues Salvatore Vinci and Heather. Heather Adair, anything else you want to add? Are you satisfied? Are we giving you enough work to now take all of this to elevate it? Fantastic. Final word? Yep.
Just one thing I would like to add, that we talk about many things, but we do not consider the need of the marginalized communities. The people living in hard-to-reach areas, people living in areas which are not accessible to healthcare workers. This solarization, what I see, has added benefits. It's not only going to design healthcare, it's going to give new confidence to the healthcare workers. Now, in Somalia, I just give you one example that the health workforce density is one of the lowest in the world. It's less than 1 per 1,000, whereas the WHO's recommendation to achieve universal health coverage is about 4 to 5. Now, what my friend has said, telemedicine, use digital innovation, solarization is leading us to achieve those things, even though there is a health workforce acute shortage, but health services can still be delivered if we are innovative, if we are creative. Finally, do we know that 18 to 30% of the children in Somalia die because of indoor air pollution? It is a massive undertaking for us. Solarization is one of the best examples that we can lead through, and hopefully can reduce some of the deaths amongst these premature children who are born in Somalia, which are easily preventable. We need to reverse this health.
No, I fully agree, and also because it's another theme. You know how fun it is. We started with electrifying health centers, and you're talking about something which is very important, which is clean cooking. Actually, they are good, and honestly, which is very good. I've seen a huge amount of women in the audience. This is a problem, is a gender problem, because it's I'm sorry to say, but it's often the woman who goes out to get the biomass or cook and all the rest. And this is, if you allow me, colleague, as unacceptable as the electrification. So thank you for saying that.
Final words? Francesco, Aris, you are satisfied?
No, that's good. Concerning Nigeria, I think we just published a remap for Nigeria, is correct? So I hope that you can find inspiration for also asking much more money to the World Bank, because we have a plan, so they can have a look at it. And concerning isolated community, we have program for remote isolated community. This is the guy you have to reach to, Gurbus, but you can write to us and we will adjust and be part of this program. And we'll start from when we'll be back in Abu Dhabi and work in this new initiative, where healthcare will be there, and we'll try, please, connect with us, and we'll try to do the best we can. And thank you for the hospitality, and it's always a pleasure to repeat again that this collaboration with the World Health Organization for us is very crucial. And naturally, with the World Bank, that we are both Italians, so this old mafia will work well, and then with the other friends here. Okay, thank you very much.
Wait. I have a little. I will give you the final word as well. But before that, I have a participant in the room who accept. I put him a little bit on the spot. He is from the IKEA Foundation, and I'm very pleased to pass you the microphone. There is one there. I hope it works.
Thank you very much. It was a great panel to see. So one thing that I would like to have you all take home with you is that the role of foundations is limited, obviously. We can do risky stuff, we can do innovation, but tackling healthcare is a public funding thing that has to be solved. What we can do is we can take the risk funding and the innovation funding that's needed and work with people like Selco Foundation to really show how it can be done And it's not just about solarizing, it's really looking at design and efficiency, thinking smart in that respect. So foundation's role, unfortunately, it gets bigger and bigger as public funding keeps going down. I'm really sorry to see that. I'm sorry that we have a bigger role to play, but our role is also very specific when it comes to showing what it could look like so that others can scale. So it was great to hear the representatives from Nigeria. I love the pride and I love the panel, so thank you very much.
Thank you so much, and thanks for the very wise word. Aris, you have the final.
No, thank you. Hopefully, when we have the SCOP in UAE next year, we will come with not maybe solution. So no. I think it's all in this room. We should be able to solve it, and a lot of solutions exist. And as Nigeria has shown, and we should collaborate. And I think with IRENA, World Bank, and we should use Somalia and as an example that if we can do it in Somalia, as you shared, put telemedicine, the latest leapfrogging technologies in Somalia to make it happen, Maria. And thanks for WHO for doing it. I'm glad we are not in an energy container, but in a health container to actually do that.
Nothing else to add, just thanking everyone. Looking at the smiles of my technical colleagues, I think everything went well. So thank you all so much. Minister, thanks for popping in and energizing us. And thank you to this wonderful panel. Please, an applause.
Thank you, Maria. Thank you so much. Thank you. Thank you so much.
Good evening, everybody. If I could just call the room to order, please. So, good evening, everybody. Welcome to the final event of the day at the Health Pavilion on communicating effectively on climate change and health. I should say, by way of introduction, I'm Dermot Campbell-Lendrum. I'm the head of the Climate Change and Health unit at WHO. So I'm a scientist by background. What that means is I'm probably the least qualified person to be moderating this discussion. Because if we know one thing about climate change, it is probably the greatest communications failure that we have of this century. So we have the evidence that we need. We have all of the case that we need in order to act on climate change, and yet we still have not been doing that effectively. And so the purpose of this session, which I'm really excited about, and I was really excited about it right up to the point where I realized I'd have to moderate it. It's a really exciting session because I think it is in many ways the key to unlocking action, not just on health and climate change, but perhaps, if we do it right, climate change more broadly. So first off, it's an absolute pleasure to be presenting in this amazing pavilion. A massive compliment to the artistic team who have put this together. I think it has probably already been mentioned. I think you know the concept here, and we'll hear about it a little bit more in a minute. But you know that the whole idea is to bring health and hearts and lungs into the center of the climate change discussions. And another thing I should also mention is that we dedicated this pavilion, we dedicate the artwork to Ella Kissi-Debrah, who probably everybody in this room knows is the little girl who is the one person in the world who has air pollution on their death certificate. And that has taught me an important lesson around climate change and health communication. Because I'm a scientist, I'm also English, so that makes me the least emotional person on the planet. And yet I have to practice saying that in order to stop. So when we talk about effective communication on climate change and health, that is the kind of thing that we're trying to get at. What actually makes people motivated and makes people act. So what we'll be doing in this session is to introduce a really amazing panel of speakers. We have a very big panel of speakers. One of the instructions I got in my notes for the moderation is you're mainly just setting this up and telling people to keep to time, because we have such brilliant people and so many of them talking about the issue. And what we're trying to do is to sort of cut through to see what we can do better on health and climate change communication. Because as a scientist, we spend a lot of our time probably on the wrong kind of science. We cracked what was causing climate change years ago. Years ago, we cracked the numbers on the impacts that was having, even in terms of human lives. We cracked the economic case some time ago. We have all of that evidence, and yet we have not been very scientific about how we communicate more effectively on climate change and health. So that's also what we're trying to do here today. The final thing I wanted to say about this is that there's an old story that goes around trying to get people to do the right thing. And it was basically a priest who was saying, I don't know why we can't get people to do the right thing. We have this amazing artwork. We have this beautiful music. We have harps. We have organs and so on. Why doesn't that work in convincing people to do the right thing? We have all the best instruments. And a friend of his said, yeah, you have all the best instruments, but the devil has all the best tunes. So it was the idea that the messages that they were trying to sell were not the ones that were cutting through. And so the devil's messages, if you like, the negative messages about it's too late to act on climate change, or it's too expensive, or health has the counter arguments to that. I actually think health has many of the best tunes. So we can tell you a positive story about acting on climate change. We can tell you about safe streets for children. We can tell you about healthcare facilities which have renewable energy and so on. So I think we actually have the best tunes. I would also say that I think we have the best singers as well. And I'm just going to do a quick poll. This test has two purposes. First, whether you can hear me. So can I ask anybody in the audience who is a doctor, a medical doctor, a clinician, to put their... That's very good, and congratulations, you are the second most trusted voice on the planet. The most trusted voice on the planet is nurses. So our team is the most trusted voice on the planet. So we have the best tunes, we have the best speakers, and what we want to talk about over the next few minutes is, or the next hour and a bit, is how we and apply those more effectively in order to drive action on climate change and health. So that's all I want to say by way of introduction. The next part of the introduction is a bit of an advertisement, an opportunity for you. So we have a film festival, a Health for All film festival, and there is an invitation for to submit films specifically on climate change and health this year. So the technology is working. A video may appear which will basically tell you that story. Great, thank you. And just to emphasize again, the overall initiative is on films for health for all, but there is a specific call for films on climate change and health. Another lesson of effective communication, make the visuals line up with the soundtrack, but we'll take that away. So at this point, it's a great pleasure to hand over to a keynote speaker, one of many, but one which is really important to us. Because one of the ways in which we've approached this is, as we appreciated we weren't being scientific enough about the evidence on climate change and health communication, was to commission a project on this, and there are representatives of the different groups who are carrying out that research project for us. But that is in partnership with Health Canada, who are also technical partners within the issue as well. So I'd like therefore to hand over to Isabella Chan, who's Deputy Minister of Health in Canada, to kindly make your opening remarks. Please.
To be part of the keynote speech. I do want to welcome also colleagues who may be joining us online, as well as those colleagues in front of me sitting here, joining us on this SAI event on communicating effectively on climate change and health. And on this note, may I congratulate the WHO. Maria, you and your team have done an amazing job integrating artwork as part of the communication as to the health impact and climate change. And it's really shown through the work that you've done around your pavilion. So congratulations on that. And maybe I would just wanted to thank you as well for our collaboration, ongoing collaboration. What I see here around this room builds on the efforts and collaboration between the Department of Health in Canada, as well as the World Health Organization, on our project to develop evidence-based guidance and tools for communicating on climate change and health. And through this partnership, we aim to develop guidance and tools that can effectively communicate the impacts that climate change has on health. And I'm also happy to know that Canada will be piloting as well as testing these tools so that others in other jurisdictions may benefit from the fruits of this collaboration. Effective communication is more important than ever. We're already seeing the health impacts of climate change, and at the same time, we need to consider the power of our messaging on mental health and the sense of hopelessness and helplessness, especially amongst our youth. Ultimately, we aim to have these tools available so that the health community can serve as agents of change and promote climate change within public health messaging at all levels, whether it is the public, whether it's affected communities as well as decision makers. So perhaps before turning the mic back to the moderator as well as the panel, I just want to acknowledge that Health Canada has benefited from the long and productive collaborations with the WHO over the last 20 years. We're pleased to be continuing these collaborations to ensure that vital knowledge and resources are available for both Canadians and the international communities. So with that, let me turn it back to you. Thank you.
Please. Thank you very much, Assistant Deputy Minister. And again, I think the feeling is entirely mutual. We really do value the partnership that we've had with Health Canada over, it's a couple of decades now on this issue, across a wide range of things. I can't think of anything more important than working out how to communicate effectively on this issue. So thanks again for the support and the collaboration. So at this point, we'll be testing our technology. We have both in-person participants, but we have a couple of remote participants as well. So if it works, then we should be able to have one of our remote participants join us, Dr. Ed Maybach from the George Mason Center for Climate Change Communication. So do we have Ed online?
Yes, I'm here, Dermot.
Wonderful. That's fantastic. Oh, brilliant. Your voice came through and now the image. So you've joined us very effectively in the room, Ed. So just again, by way of introduction, for those of you who don't know, Ed is one of the, I would say, on climate change and health communication, one of the people who is actually carrying out the kind of research I like, sort of empirical research on what works on climate change and health communication. So I'd like to turn to you, Ed, to give us your short briefing on what we know about what does work on climate change and health communication and what doesn't. Over to you. You have the floor.
Yeah, thank you so much. And I'm really sorry that I'm not with you there in person. My heart is certainly with you. The work you're doing could not be more important. So I want to make a couple of points. I want to reinforce what Dermot led with today, which is the fact that he didn't say it in exactly these words. I'm not sure anybody uses these words except Americans, but we health professionals worldwide, we have the ability to punch way above our weight class, meaning we have the opportunity to create a narrative and sustain a narrative that will help people of the world see climate change in an entirely different way, in a way that will escalate their sense of urgency and escalate their urge for potency to hold the blowtorch to the backsides of our elected and our appointed officials to do what is necessary to protect human health and well-being going forward. And Dermot pointed to the first reason why we can punch way above our weight class, and that is we have a superpower. Health professionals have a superpower, and that is our trust. We are nurses, doctors, pharmacists, other health professionals. We stand in a class by ourselves in terms of being trusted by members of the public in nations around the world. Politicians, conversely, in almost all nations are really at a sad place in terms of how little the public trusts them to do the right thing, to do the people's bidding. So even though politicians hold all the power, we actually have incredible opportunities for influence if we use trust, our superpower. The second point I want to make is that decarbonization, rapidly doing away with fossil fuels as the source of energy that powers the global economy, is not only the planetary health opportunity of our lifetime, it's the human health opportunity of our lifetime. And the planetary health benefits, the climate benefits in particular, will take many decades to fully manifest. So as we accelerate in decarbonizing the global economy, it will still take many decades to fully appreciate the climate benefits of that. But the human health benefits and the more proximal environmental benefits in terms of clean air and clean water, those begin to manifest immediately, and local to the communities and the nations that take those actions. One of the reasons why climate change is the ultimate dragon, the ultimate dragon of stasis to public policymakers making the right decisions, is because the benefits play out over many, many decades. And mostly we think of them as playing out far, far into the future, and they play out in a diffuse sense in communities around the world. But the human health benefits of decarbonization play out immediately, and they play out in the nations and in the communities that take those actions. So by starting a narrative in which we talk about the human health benefits of decarbonization, we're talking about benefits that manifest locally and immediately, which begins to slay that dragon of inaction. And that perhaps uniquely, is something that we in the health community can do. We also know, by the way, that the public respond, not only do they trust us as health professionals, but they respond well to what we say. So I've worked with WHO, I've worked with the Global Climate and Health Alliance and others to actually test a variety of different ways that members of the health community can make the case that climate action is action. And those actions, as I've already said, pay off immediately and pay off locally. So we don't have to trust that other countries around the world are going to do the right thing. If we do the right thing, we in our country, in our community, we begin to benefit immediately. Members of the public understand this narrative. It makes sense to them. It helps them understand personal relevance of climate change in a better, deeper way than they previously did. And very importantly, it helps them understand the benefits of climate action, and it helps build their sense that these are actions that we need to be taking right away in our community, whether or not anyone else does the same. We also know that we've surveyed health professionals in many countries around the world. We found that regardless of a country, the majority of health professionals tell us in response to our surveys that they get that climate change is a profound human health threat. And they get that climate action is a profound human health opportunity. And they would like to see their peers, their professional organizations, their other healthcare organizations, as well as them personally getting much more involved in helping members of the public, and very importantly, the policymakers, the people who make the decisions in their communities, in their nations. They'd like to use their trusted voices to make sure that our point of view, the health point of view, is understood. So right now, there might be tens of thousands of us worldwide who are using our trusted voices to carry these important messages to the public and to our policymakers, but there's a potential to have hundreds of thousands, millions, possibly even tens of millions of health professionals using their trusted voices to convince our politicians, our elected officials, now is the time to do the right thing. And doing the right thing by accelerating decarbonization will pay profound benefits, and your constituents will appreciate the fact that you have taken these actions. The final thing that I wanted to share is, while most health professionals understand their role and would like to play this role, most of them tell us that there are a variety of impediments, a variety of barriers, making it difficult for them to do so. So those of us who are in this conversation today, we have an opportunity to create the tools. Coming back to Dermot's introduction, we have we know what the best songs are, but we still need to create the instruments whereby the trusted voices of health professionals in communities around the world can carry these tunes, can project these tunes loudly, consistently, repetitively to the people who need to hear them most, members of their community and the people who make the policy decisions. So we have the opportunity to punch way above our weight. We've got everything we need, with the possible exception of a few more tools that those of us with Health Canada and WHO and Global Climate and Health Alliance and others, we're working to try to create those tools so as to take advantage of this extraordinary opportunity that we have. I hope that your voices are heard loud and clear at COP27. I hope to join you all at COP28, and with each passing year, I'm confident we're going to have more and more influence on the decisions that the leaders of the world make. So with that, Dermot, I pass the microphone, so to speak, back to you.
Fantastic. Thanks, Ed. I can confirm from the communication point of view, you came through loud and clear for being in the room with us. So I hope you'll stay for the discussion as well. Thanks also for leaving us with, I think, quite a striking visual image. If I have it right, it's turning a blowtorch onto the backsides of elected politicians. That's a picture I'm not sure I wanted to take away with me, but I think I will. I'm just going to check. I know our director, Maria Nera, needs to leave for another event, but she is our most effective communicator. She's also my boss, so she can say what she wants, say nothing, or leave. But I'll just hand you the mic in case you have a few words.
Thank you, dear Mit, and thank you all. This is one of my favorite topics, communicating effectively. And I think every morning we ask ourselves, what do we need to do to better communicate? Because we have all the science. We are so much convinced, and still the message is not reaching people, the people we wanted to influence. So I think we need to find out positive messages. If you want to create a movement, you need to have a mission, you need to have a goal, you need to give some stimulus, some motivation to people to follow you, to implement it. And I think we have all the elements here. So we have amazing communicators in this room. Take opportunity to listen from them, starting from this British one who pretends to have no emotions, but he's extremely good on communicating. And let's create this movement. But again, to have a movement and to be successful, you need to have something that make people dream about it. And I think we have it. Try to put the words around that dream, and I'm sure that we will be the best communicators ever. Over to you. Thank you.
Thanks so much, Maria. And as you see Maria leave the room, if you see Maria about the place, you'll realize she's somebody that we basically wheel her around cops, pointing her at television cameras and high-profile people, because she is one of the most effective communicators, I would say, in the field. So just to continue through this amazing panel, the next panelist, if I can turn to you, Dr. Kumar, I'll quickly, I'll invite you to either come to the front, stand, whatever you would like to do. I will just quickly read you Dr. Kumar's sort of list of titles. He's a founder trustee of the Lung Care Foundation of New Delhi in India, chairman of the Center for Chest Surgery and Chest Oncosurgery, and director of the Institute of Robotic Surgery at Sir Gangaram Hospital, New Delhi in India. That's the kind of qualification. So I'll hand you, I also know he's a really effective communicator on this issue. So the floor is yours.
Thank you very much for those kind words, and thanks to WHO, particularly to Dr. Maria Nera, for always being very, very supportive and very encouraging all the time in all that we do. A lot of what actually I wanted to say has actually been already conveyed by Ted. I strongly believe that both air pollution and climate change are not chemical issues, they are pure health issues. And the impact of that is seen very grotesquely by none other than health professionals. When we sit in our OPD, I'm a chest surgeon, and I want to share that in the last 30 years of my chest surgery practice, I have seen a huge change in the demography of just one disease I'll mention, that's lung cancer. In early 90s when I started, most of the patients that I saw were having history of smoking, clear-cut smokers. And today, nearly 60%, more than half of my patients are so-called non-smokers. And they keep asking this question, we know that smoking causes cancer, I'm not a smoker, why am I developing this cancer? And it's very difficult for me to tell them that you are developing because you are a smoker even without smoking a cigarette. Because the city that you live in, the air that you breathe, has more more smoke than you would have inhaled by way of smoking. 40% of the patients are women. The age is getting younger and younger. Earlier, most of the patients were in 50s and 60s. and now the peak age is 40s, 10% of the patients are in 30s, and the youngest patient I've seen is a 26-year-old girl from a non-smoking family. Why are they developing lung cancer? We know that you need to have tissues exposed to cancer-causing agents for at least 25-30 years. So how is it happening? Because now a child who is born in a polluted city becomes a smoker from the first breath of his or her life. A child born in New Delhi today, where PM 2.5 is 400 microgram plus today, will be smoking 10 to 15 cigarettes from the first day of his life. So these are hard facts that we see every day, and therefore we are motivated. So first thing is, medical community is motivated because of the trauma, because of the destruction, because of the effects that we see. As has been repeatedly said, doctors are trusted, and when someone has to talk to public about a health issue, who better than medical community to talk about it? So they are motivators, much better motivators than anybody else. So I call doctor a motivator as far as encouraging people for this is concerned. So I believe that doctors should play a major role, and that's why in India we set up this group called Doctors for Clean Air, which is a conglomeration of doctors from across the country, cutting across specialties, who have one thing in common: their passion, their commitment to work for the cause of air pollution. Communicating things effectively to people is one of the things. When you want to communicate something effectively, three things you need. You need a credible information to be communicated. You need a credibility of the person who's communicating, and you need it to be communicated in a language, in a simple language with people. These are the three things. So that's what we have to share with people. Images of lungs that I see as a chest surgeon in the OT, where instead of the pink lungs that they are born with, these become black due to the effects of air pollution. And I found that every time across the globe, whenever I've shown these pictures, people have taken pictures, and these have been tweeted and WhatsApped around the world, because this is credible information coming from a person who can be trusted. Similarly, when we wanted to show to people that this is what is happening inside, how do we pictorially convey to them? We did an experiment in Delhi where we put up a lung replica made of HEPA filter and put a small fan behind it, and we showed how over a period of 10 days, starting from absolutely white, it turned to black. And this attracted huge media attention. People said, oh wow, if this is happening to these lungs, similar things must be happening inside also. And third thing, you need to do some community studies to actually scientifically complement and prove what you have been saying. So we did a study among school children in Delhi, where we studied the lung health of 1100 children across various schools. Doctors for Clean Air did this study, and we were astonished to find more than 50% of the children actually were complaining of sneezing and persistent cough, and more than 29% had spirometry proved asthma. So when role of the doctors is in developing this credible information, conveying it to people in a language which they can understand, simplifying it. Because a lot of research which is published in scientific journals is actually in technical terms, which doesn't go down to the grassroots level people. So I think important role of doctors is to convert that scientific knowledge into easy to understand, easy to comprehend a language, and convey. They understand that there is a huge damage to the health which is occurring. We need to tell them that this is not something which is going to happen tomorrow. Climate crisis, health crisis, air pollution, these are today's problems. We are seeing the effects every day in our life, and it's something which should have been rectified long back but was not done, but the time to act is now. So I think as doctors we have a vital role to play. And Doctors for Clean Air, I feel, is a movement which actually should become international movement. Doctors from across the world, various countries should form similar groups names may be different, but they should be going out to people and communicating. It is a health issue. You can build beautiful houses, you can have your private jets, yachts, etc. Leave all that for your children, but your children will not be able to come out of the house without an oxygen mask. That's scenario one. And scenario two is all that is taken care of, but your children have nice, clean air to breathe. I think it's our duty to leave cleaner air for our future generation because that's a human right. And I think doctors have a huge role to play. Thank you.
Wonderful. We told you we had some of the best speakers on this issue in the world. I think we're evidence-based. We've proved our point. Dr. Kumar, I know you have to leave for another event. I was going to say you're welcome to either stay with us or to rejoin the audience or to leave, but I'd really like to once again thank you for that fantastic presentation. I would also say that usually when I see Dr. Kumar present or on TV, he's usually wearing a doctor's white coat just to drum home the point that medical professionals are behind this. And one small word of advice, Doctors for Clean Air I think is a wonderful idea. Midwives and nurses for clean air, I think you should also be convening as well. The family is big, but thank you once again. So I think now we'll change tack slightly. I'll just quickly again remind our speakers we have a fantastic program, limited time, so we'll ask people to keep their interventions short and sweet. Hopefully we've sort of scared the world with the images of cancerous lungs caused by smoking. We're going to take a slightly different angle on this now to talk not just about the fright and the shock, but also the power of art and the power of beauty effectively to raise awareness on climate change and health. So it's a great pleasure to invite Victoria Pratt, who is from Invisible Flock, creative director of Invisible Flock. So it's a relatively simple question to you. What have you learnt in your experience about using art to communicate effectively and hopefully positively about action on climate change, but also the connection to health?
Thank you very much. Can everyone hear me okay, just to begin with? This is a really interesting about this question around why we are now where we are and the large failure that you talked about in the beginning. And I think there are lots of reasons we could draw upon, but one I particularly wanted to mention was the climate justice element, and that we need to be asking ourselves not just what hasn't been communicated, but who hasn't been heard. And I think those around the world who have been feeling the impacts on their health for the past 30, 50 years, that those communities who know that it's linked to climate change, they know that it's linked to floods, they know that it's linked to the seasons changing and the flowers and the plants shifting their patterns. I feel like partly those voices need to be more involved in these conversations, and I think those can come through things like films, storytelling, art, but I'd also like to see more of those voices up on stage with us in these kind of events. And then I suppose to the more positive side of what I wanted to say around how we communicate with art, I think it's really actually about collaboration between many disciplines. So it's about pooling all of our skills. Like when I hear everyone here, everyone's a brilliant, passionate individual, with excellent expertise. And I think people, us as individuals, we hear messages differently. We speak different languages. Some of us have brains that visual messaging is much more drawn to. Some of us written text. And I think what art practices and collaboration with science can do is it can try and give more of a broad spectrum of messaging tactics, I suppose, for lack of a better word. So the sculpture is one example that we put forward, and for me, this I really fought making this because I felt like it was too obvious, and that's just probably because I'm more the conceptual end of art. And actually, I had to step back and go, no, this isn't about my specific vision, or it is about what can get the message across, what can make people feel. When we were talking earlier at the opening of the pavilion, I forgot to mention that if you touch the sculpture, it resonates with the frequency of the human body. So we're really encouraging people here to really feel the stories, feel the situation we're in. Data, evidence, as we know, is essential, but data alone doesn't make us fall in love. And I think the stories and the intersection of science, arts, communities, stories, all of it will hopefully touch our hearts and make an impact. Thank you.
Again, thank you for a really amazing perspective, and just to take that message of a diversity of perspectives, a diversity of approaches to this, and as I say, we've been trying to drum home the science for ages. We found new ways to try and do that with not just giving people the figures. It's about the human stories, but a beautiful presentation with a story that people can connect to adds a whole new dimension to that. So we'd really like to thank you for that. So turning again through the rest of the panel, I'll just make again a reminder about timing and keeping intervention short. I think we should be able to go to another one of our remote presenters, and I think I can see them on the screen. So Denise Barden, Professor of Sustainable Practice at the University of Southampton, and Herculean Climate Solutions, which is a wonderful name. Can I just check that you're connected, you can hear us, and
yes.
If we can hear you, then the floor is yours.
Yep, can you hear me? Can you hear me okay? Good. Well, thanks for inviting me to be here. So, yes, I set up the Green Stories project, actually. Based on a lot of the messages you've been getting across, this idea that we need to be focusing on solutions now. I think if people aren't aware of the climate crisis, it's because they're choosing not to be aware. So, and pushing it too hard can lead to just basically eco-anxiety. So we were worried that most of the cultural references in our news and in stories and films that reference the future are basically 100% almost catastrophic and doom-laden. And I think if we want to really get the message across, we need to give people a positive vision to aspire to. So I set up the Green Stories project to encourage writers to write green solutions into their stories. And, Herculean Climate Solutions got in touch. They were a group of chemical engineers who were just so panicked by it all, and they had such wonderful ideas, they just couldn't get them out there. And they said, why don't we do an anthology of climate solutions wrapped in short stories for COP27 delegates? We've done that. It's called No More Fairy Tales, Stories to Save the Planet. And we've got authors like Kim Stanley Robinson and Paolo Bacigalupi contributing stories, and lots of other authors. I've contributed some myself. And each one of them either looks at a technical or science or nature-based solution, or I'm actually, I accidentally coined the term, I think, social science fiction, because I'm interested in the systemic aspects, like, what is driving these problems in the first place? Is that the GDP is leading to consumption as the main measure of success? Is it that short-term electoral policies mean long-term decisions are just impossible in most democracies? Should we have citizens' juries? What if we have a personal carbon allowance? How would that funnel investment into sustainable things? So I'm quite interested in the systemic aspect and cultural aspect. But we focus very much on communicating a positive approach with an engaging character and plot. So, for example, I wrote The Assassin, which is set in a citizens' jury debating climate solutions, one of which is an assassin. And we've compiled this web pages, which we're encouraging people to look at, which shows every solution and how you can make it happen. Because I'm very worried that, we are ourselves who are involved in this, quite frankly, are often frightened. And it's quite hard not to communicate that. But people don't want to be frightened. You know, putting your head in the sand is actually a very rational response. So trying to take that eco-anxiety and harness it towards positive, effective action is what we're all about. And we've just decided to use fiction as a way of doing that. So I'm really excited about that. And one more thing, a lot of people talk about trusted narrators of climate solutions and doctors and nurses. Another project I've been doing is with hairdressing. Because actually hairdressers are trusted people with information. And we've been looking at actually hair, a lot of guys don't get this, but actually hairdressing can be a very high carbon resource with a lot of hot water and chemicals. And we find again that actually health and beauty as the way in is the most effective way. So for example, using too much hot water and product, it could be damaging and aging to the skin. You know, chemicals, again, a lot of them are actually quite carcinogenic, especially if you put them on top of the pesticides in your food. So that's just to tie into some of the previous points made is, yes, using health and beauty is a nice way in. You don't always have to play the green card. But we also hope people will engage with the anthology No More Fairy Tales, which I think we've got a QR code on the COP banner, and make use of the website, because it's a nice way to reach those who may not choose to engage in a climate change documentary, bearing in mind it's fiction. So I think that's mostly what I wanted to say, but happy to contribute later in the panel discussion.
For a really interesting and stimulating intervention. It's one of the great advantages of these different sessions of bringing different voices together. It would never have occurred to me the idea of stories to save the planet, social science fiction, and effectively promoting positive stories through hairdressing, but all of them make perfect sense. And so thank you for that. For the next speaker, it's a real pleasure to invite Dr. Courtney Howard, who is the president of the Canadian Association of Physicians for the Environment, also an emergency doctor. I should also say, to make reference back to the Canadian connection and the support that we have with Health Canada and with the project that we described. We have 3 expert groups supporting this. We have the Global Climate and Health Alliance, who you'll hear from in a minute. We have Ed and his group at George Mason, and we also have the Canadian Medical Association. So again, we really do think we have the best people on this case. And with that, I'll hand over to Courtney for your remarks as well, Courtney.
Thank you so much. It's such a pleasure to be here with so many of my climate and health heroes. So I'm going to talk about some of the people we can help out, and I'm going to stand up because that's what I did when I got pulled into some of this work. I live in the subarctic in a melting place, so I'm an emergency physician. I serve a patient population that's already coping with temperatures 3 degrees Celsius warmer than when an 80-year-old elder was born. So when I got to Inuvik, which is in fact where I first read the Lancet Commission on Climate Change and Health in 2009, and it said that climate change was the biggest health threat of the 21st century, I was surprised, but my patients were not. They said, well, yes, my cousin was going out on the land last week and he fell through the ice. That's never happened before. It has food security challenges, mental health challenges, cultural challenges. And so as a doctor, when we see a diagnosis, we want to find a treatment and we want to participate in the treatment. And I think one of the real benefits of getting better at communicating and better at this work is it helps us treat the health emergency of climate change. And that feels way better than just sitting there. And so one of the people who pulled me in was my friend Doug. So he is an economist. And there are people that we need to really have compassion in our hearts for, and those are economists that are trying to sell carbon pricing. Like, imagine if that was your job. You want to impose a tax on people for a chemical in the air. Like, try to communicate that. So Doug was one of these people who lives really far out of town, chops a lot of wood, and thinks a lot. And I walked in and he had my friend Ryan Miley's book on the social determinants of health on his table. And he said, I want you to present with me on carbon pricing. Because he wasn't a scientist, he was an economist. And he didn't feel qualified to make the case for the carbon price. So we played to sold out libraries all around the north, as long as we brought muffins and cookies. And what would happen was I would go first and talk about the health impacts that we were seeing and how the diagnosis of climate change meant that we needed to take action immediately. And then right when everybody looked and everyone's seen this look in a presentation, like super sad and like, oh my gosh, right when they looked like that, I'd be like, and here's Doug. And then Doug would come on and talk about carbon pricing, and then people cared about carbon pricing because they were looking for a solution. And so it was a 1-2 punch that really worked. And in fact, we took that all the way from the libraries of the North to a couple of COPs ago. I was doing that work with Catherine McKenna. Canada did enact a national carbon price. We at the Canadian Association of Physicians for the Environment were one of the interveners in several court cases, including the Supreme Court case. And when it was upheld, they asked one NGO to the press conference with the minister. It was the Canadian Association of Physicians for the Environment. So what that tells me is that in communicating the impacts to our patients and the potential to improve health and also decrease air pollution, keep kids out of the emergency department with asthma, save healthcare costs immediately with any intervention that decreases air pollution, whether that is a carbon price that reduces air pollution, phasing out coal-fired power plants, we can bring those patients' stories into the policy space and help out our friends, the economists, the urban planners, all of the people who are trying to change energy systems, and help them understand that their work saves lives. Because when people go to work in the morning and the story they have in their head is, I have to implement a carbon price, that's a completely different story and motivation and place in their heart that they are coming from than if they say to themselves, I am here to help heal my population. So I think that our stories can not only provide the incentive, but help people understand that they too can be healers. I have stayed up at 3 o'clock in the morning so many times in my life through dedication to patient health, because that's what doctors do, but we all have a role in health. And so we can share that with our patients, and we can share that with other people in this room, in this giant complex who are doing this work, so that they can go to work and know that they are making a huge difference and really fulfilling their best potential in this world as human beings, as we all are. So that is my message. Let's help sell the health co-benefits and help out our poor carbon pricing economists, because man, they got a tough job.
Okay, one microphone working, I believe. So again, Courtney, absolutely fantastic insights as always. It also reminds me of an adage that we have: if you have a tough job that needs doing, give it to a busy woman. And Courtney is somebody who lies in the day job and also spends time campaigning on climate change and health. And I think there's an attitude there that you see in the medical community, probably best exemplified by emergency physicians. So much of climate change discussion, terrible story and gloom, people getting depressed, thinking somebody else needs to do something about it. That doesn't happen in emergency wards. Have somebody turning up sick and the emergency, this child's in a terrible state, somebody ought to do something about it. They get on and do something about it. And that's part of the attitude, I think, that the medical and the health community brings to this, that it is not something for other people to do, it's something we need to play our part in, even if we're really busy with other things, and even trying to save the world's carbon pricing economists as well. So you have a big heart, Courtney. Again, to carry on with the fantastic panel that we have, the next intervention you've heard teed up in some ways. We have an intervention from Dr. Maria Nelson, who's a professor at Department of Epidemiology and Global Health at Umeå University in Sweden, also one of the leading authorities behind the Lancet Climate Commission and the Lancet Countdown as well. So again, with my habitual reminder on time, I'll hand over to you, please, Maria, to check you can hear us and we can hear you.
Thank you so much, Dom. It's really nice to be here also with you tonight on this important event. And I think it's really important also that we raise the issue of us, just like Courtney did now, also about us as a health community, and also taking larger steps becoming more active in this. And we've sort of discussed, should we tell people about all the really scary stuff that we can see when we do our research on the impacts on health from climate change. And there is, of course, plenty to be concerned about. And I'm quite often asked if there is still hope. And some people sometimes also say that one should not talk too much about the risk, so that people risk that they lose hope and thus become passive. And you have also talked about the importance of using art and talking about the benefits, and of course we should do that. But I also want to say that I think it's just like Dr. Kamara would like to compare with tobacco, because there is also something about having to face the risks as well, but then create hope on how to go about. And imagine if we, with the scientific knowledge that was built in the second half of the 20th century, that smoking was actually the cause of death for half of the smokers, and you chose not to tell people about the risks because it could create anxiety and feel difficult. Of course, it wouldn't have been ethically correct. And nor is it, I would say, with the case with the climate issue as well. So I think we need to both have the courage to speak up and look climate change in the eye in order to then act and do the right things together and cooperate, as so many of you have also said before, and also discuss and find the ways how we can reduce the risks together, and also to protect the most vulnerable. So we feel that we are doing something that is ethically right. And of course, we need to look at the positive side effects that we can see by action and talk about that. And sometimes I feel that we've done that too little with our decision makers. That we have a responsibility to do that even more. Some of the measures, of course, will come with costs, but there is a long list of possible positive side benefits of climate change that are too rarely talked about, such as cleaner air, cleaner water, more nutritious food, stronger health systems, better public health, but also probably greener, more sustainable technology as well. So, and if climate change accelerates, there will be no cost that we can otherwise count on if we passively let time pass. So I think it's a balance between communicate the seriousness, but also really highlighting the benefits and the collaboration and what's positive about that. And also with art, really touch emotions as well, because then you also can become more motivated. So that's my saying just now. Thank you.
Thank you so much, Maria. And again, to underline one of the points that we always want to underline at WHO. So research universities, initiatives like the Lancet Climate Countdown are absolutely fantastic in putting together the evidence that we need. And we always have to be driven by the evidence. We always have to reference that. And that is also very well referenced in the climate movement as well. If you look at the actions of, for example, Extinction Rebellion, one of their 3 demands is tell the truth. Just follow the evidence, follow what that what that is telling you. And so we as we talk about the different ways in which we communicate, we always have to tell the truth. We always have to make reference to the evidence. And just very very quickly, Maria, I have this almost bet against myself whenever I talk to somebody from Sweden and your colleagues in Sweden. I have to try and stop myself quoting Greta Thunberg, and I never manage it because I think she is such an effective communicator. And on this issue that we're talking about risks and doom versus action, one of the quotes I like very much about her is that you keep looking to us young people to ask us, where is the hope? So don't talk to us about hope. As soon as there's action, that's where the hope comes from. And that's exactly the same on climate change and health. We have no good news to tell you about the impacts of climate change on health we have 1 million really good stories to tell you about the health gains that will come through climate action. And I think that's part of the attitude that we need to, well. So thanks once again, Maria. So the next person on the list is Jen Kuhl, who's also one of the partners. Please, Jen, from the Global Climate and Health Alliance, also one of the partners in this project. And as we've heard so many times, this is about pulling together a community, pulling together different voices of GCHA as I see it. So over to you, Jen, you have the floor.
Thank you so much. And it's really a bit of an overwhelming honor to speak at the end of such an incredible and illustrious panel. We've got about another 15 minutes, so I'm going to actually invite you to take a moment and like shake yourself out. It's been a long day. It's loud in here. We've been talking for a long time. Just like move your body just a little bit. I'm going to do my best to pick up a few of the threads that we've heard shared today that I think GCHA, in working with our many network partners, has found really valuable as we talk about health and climate change. And the first one I want to highlight is the power of sharing stories. We have felt this throughout this presentation, from the moment Diarmid talked about Ella, Courtney talking about the man following her patient who fell through the ice. When we tell stories, it gives people the opportunity to understand how this giant global crisis relates to them. It makes it understandable. Just for like a glimmer of a moment, people can see how it matters to them. And I think both the challenging and devastating stories like Ella's story and the hopeful stories, the stories of success, the stories of communities and doctors that I know that we have in Canada. There's this one very inspiring story about where CAPE did to get a ban on coal, a coal phase-out plan. Telling those kinds of stories are also really hopeful in these dark times. So you have stories. I know you have them because you meet with patients and you live in this climate-changing world. So I think really there's an Indigenous writer from Canada whose name is Thomas King, and he says, the truth about stories is that they're all that we are. And so as you find them, do keep telling stories because they're another form of art. The second thing I want to highlight, and again, is this power of the positive. There are so many ways we can paint a vision of a bright and inspiring future for people from the health lens. So often, not only are we hearing the doom and gloom of the climate crisis, we are hearing that the responding to it only means cutting back. It means we have to give up our cars. It means we have to turn down our heat. It means we have to potentially pay more for our electricity as we switch to renewables. And when those are the narratives, when the narratives are it's going to be hard and worse, that's a really good way to make people shut down and stop listening. People get paralyzed in the fear of what is coming and turned off by how kind of like awful we can be when we kind of guilt them about the energy they're using or using their cars. We can tell different stories. We can say, you know what, if we invest in electrified public transportation, you can have cleaner air, you can have safer, quieter streets for pedestrians. We can have be on the path to a low carbon future without climate change. And you also have an equity win. Transportation is one of those things that allows for broad communities to be connected to city centers, to hubs, so you don't have to have a car to get where you need to go. And there are so many instances of those triple wins. The food systems are another one, where if we are investing in more sustainable food, we can address hunger, we can again address the climate crisis, and we can respond to those places where people are still struggling to feed their families. So I think health has a really important place to paint a bright future. And the last thing I'll say is we have a really recent example of the power of the health community bringing its voice to an issue. So we worked with the Fossil Fuel Non-Proliferation Treaty to have health providers so grateful to have the WHO sign on really strongly to that call with powerful remarks from the Director General. And having WHO come out and say, there's not an option, we have to phase out fossil fuels, we need a treaty that supports us to do that, the way that we had the tobacco treaty. Having health come out on that was actually, we've heard from the treaty organizers, the tipping point that allowed countries to start making that call. So we first of all saw Vanuatu come out and call for a fossil fuel treaty. Many countries in the European Union have pushed the EU to call for a fossil fuel treaty. And today, Tuvalu also made that call. And I think the health voice was a really powerful addition in getting us over the line. And I think that also speaks to this one other thing, which is showing up for our partners. Health people, we don't have to know all the science about about how the world exactly and CO2 is changing. People know that. We just need to bring our stories and our health voice, as Courtney said, to the economists, to the frontline communities whose voices are unheard, and to other people who've been having this conversation for a long time. The health community can show up and bring our power in a really impactful way. So thank you very much for giving us the space to share.
Brilliant. Thanks so much, Jen. Again, a fantastic intervention, and thanks to WHO. I'll just say quickly a couple of words on that, because when that call came to us on the Fossil Fuel Non-Proliferation Treaty, from a values point of view, it was a very easy one for us, because there was nothing in there that we didn't agree with. We also thought that it cuts through the nonsense. To not talk about fossil fuels when you're talking about climate change, for us would be like talking about lung cancer without naming cigarettes, or talking about AIDS without naming HIV. So we do have to tell the truth. We do have to be direct, and that's something else that I think health can bring to this, that clarity in messaging. But thank you very much for that. So I think we have now had the interventions from all of the panelists. We're actually perfectly on time. So that repeated message, taking that's Ed's mantra. Is repeated often by a variety of trusted voices. I just went for repeated often. So we have a couple of minutes before we close the session. So I'd like to see if there are any quick reactions from the floor. We have a hand up. We have one hand in the room. I'm just going to quickly go to the remote one, which is my colleague Gilles Rebou, who has had his virtual hand up for some time. I'll just say, Gilles, we did play your film at the beginning for the inviting the submissions for the universal health coverage, specifically on climate change. But quickly, Gilles, if you'd like to make another remark or comment.
Yeah, thank you, David. Yes, thanks a lot. I was here since the beginning. I saw that you played the films. And in fact, I just wanted to make quickly a short reminder about that, because this L4 Film Festival and this particular call for short films on climate change and health is going to really echo all what was said by all the panelists today. So just to go quickly through that, health professionals are invited to submit their films. So as you mentioned, Darmid, they are the most trusted persons, group of persons about to speak about the topic, and Ed mentioned that it's indeed, we need amplification of the health professional voices. So the Film Festival is a way to amplify their voices and their stories. But also, we call for journalists and TV broadcasters to participate, of course. So I think you didn't speak during this panel about the role of the media, but the traditional media have a huge role to especially for journalists to be trained and for journalists to look for the truth, as you mentioned, David. It's very important that journalists would learn, because climate change is a very complex phenomena. So there are many factors. So certainly the scientists can help journalists to tell the stories. And yes, another very important target I want to highlight, and I'm not going to be too long, is the youth. We have also a special prize for student film, a film made by students, and we invite the youth not only to submit their films, but also to participate next year in some kind of deliberation about the shortlist that we are going to do. So a lot of opportunities with the academia and students in universities, but also all the youth activists around climate change issues. So yes, I don't want to take, and maybe the last point I wanted to highlight, there will be a shortlist of 15 stories published by mid-March. The call for films will close on 31 January. There will be a winner with a trophy and a payment offered to the winner.
Gilles, so we've got the horror stories, we've got the positive stories. We have an opportunity to broadcast if you have creative ideas to submit to that film festival. So thank you very much, Gilles. So we have at least one comment or question from the audience, so over to you.
Now? Yeah. Thank you so much for bringing up youth. I'm Bea. I am a medical doctor from Switzerland. I'm part of the International Federation of Medical Students Associations. So we are the youth here. And thank you so much also to all the panelists for bringing up this important topic of climate change and health and how do we communicate about this. After the session, I feel a bit that we talk about climate change, the climate emergency, we talk about health, but we don't talk about the elephant in the room, how the economy also affects health. We communicate a lot about the health impacts of the climate crisis, but we also, as health professionals, need to address how infinite economic growth is like cancer, right? It's like growing something that it's not healthy. And I think we need to develop a language on how do we link the economy and the current system and really like lead the transformation towards a healthy future. And I would love to hear some thoughts of the panelists on how do we communicate on this important topic.
Thank you. It's a wonderful and important intervention. Can I just check if I can maybe take another one or two comments or questions before we seek maybe one or two reactions just from the panelists before we close up? Okay. So I'll take two and then we'll close from there, but thank you.
Hello, so I'm a young doctor from Pakistan, and as everybody knows that recently Pakistan was hit by massive floods and it has caused breakout of a lot of diseases in the flood affected areas. And for a very long time I had been advocating to, make our healthcare system resilient when it comes to the conversations related to climate change. So my question, because I'm a public health aspirant, to the experts here is that what tangible policies can be used to, add to basically advocate for building on climate resilience when we're having conversations as advocates of health with the leaders and the politicians. So that is something that I have never been able to find the answer to back at home. So I'm expecting to get answer here. So that is something I really wanted to know. Thank you.
Wonderful, thank you. We'll take the final question, and then I'll ask panelists. You don't have to, but if you would like to make a very short intervention to react before we sum up, then be prepared.
Good afternoon. My name is Dr. Calais Philippe, and I'm here with my colleague, Dr. William Hamilton. We're from the Bahamas, and we're part of the Climate Change and Health Project team. We were given 2 grants, the EU Cariform grant to develop our Health National Adaptation Plan, and we're also working on the GCF Readiness Proposal. In each of those, there was monies available for communication. Can you tell me how much money was available? Not enough. If communication is significant, is important to translate to the community about climate change, then the request is made to increase the budget. As a matter of fact, With the EU Care Reform project that was run by PAHO WHO, we paid $54,000 for a consultancy that cut the budget to zero for communication. So we know the information, physicians know the information, scientists know the information. The people need to know the information to transform their lives through behavior change. So the request that I'm making to the WHO is to look at your budgetary allocation for the communication component, because we do have the information, the science, the health, but we cannot translate it because $10,000 will not be enough for a communication budget. You need a large budget. And we look forward to receiving that budget because we're at the end of our project and we need to communicate information because we just finished our knowledge, attitude, and practice survey, which was supported by George Washington. They did that survey, learning from the population. The next step now is to take that information, translate it for people to understand. And we don't have enough money to do that. So it would be very important to put that in the budget moving forward. Thank you so much.
I have to say that's a really prime example of effective communication. Come on at the end and say, show us our communication money. But perfect. I think I'm looking at the organisers. I presume we do have to close. We do need to bring this to an end. I would say by way of advertisement, we'll be here all week. We'll be here for the next 2 weeks. This is your home for climate change and health communication and discussion. Do come here and follow up on those discussions, because we can't handle all of it in one session. We can handle quite a lot of it, I think, over the next, if you can find it and so on. So just in order to start to bring this to a close, I will just invite the panelists, if you would, to make a short response to anything that you've heard, particularly the questions that were posed by the audience. Please feel free to do so. I think, did I see, Denise, you had a hand up earlier. I don't know if you would like to intervene to make a short comment.
Yeah, sure. So I think the point about economic growth was so well made. I think if we're looking at sort of all the issues about trying to remove carbon dioxide, I see it as a bathtub. You're trying to empty the plug. There's no point if the hot tap is full on. And of course, in the UK, we had Liz Truss saying anyone who thought, cared about conservation were enemies of growth. And economic growth and the gross domestic product as a metric of success is so last century. It's so out of date. It needs challenging head on. And there's such a sort of, I don't know anybody who's thought about it who still thinks it works. So goodness knows why it still exists. But a different metric of what we count as success, whether it be a well-being index or happy planet index, is absolutely essential. And again, many of the stories in the anthology attack this point to try and generate awareness. And our website, we're going to try and link to campaigns to get this going. So I think that was a really well-made point. And again, with resilience, it's funny, the way I think a lot of the authors have dealt with their eco-anxiety is to write the solutions as if they happen in fiction, they can happen in reality. And resilience on the sort of economic level, again, can be really helpful by going local, by having community-owned energy, community, food, local currencies that can supplement national currencies, because I think we can expect to see infrastructure breakdown just as part of the globalized economy, let alone adding cybersecurity in the climate crisis. And just lastly, there were several comments, what's best, scaring people or solutions? And I think people respond very differently. One size does not fit all. Some people will respond to fear, some to solutions. I think the trouble was it was for a while only fear. So I think we need both. But what I will say, if anyone wants to try and scare people, there's no point doing it unless you tie that fear to a potential action they can do. Otherwise, I think it's just counterproductive. So that's me done.
Wonderful. Thank you once again, Denise, again for a really good intervention. So to complete the virtual interventions, see you have your hand up. You have the floor.
Yeah, I do. Thank you. I'd actually like to repeat something that Denise just said, which I think is incredibly important, and that is that fossil fuel CEOs tell us that what we propose will, quote, kill the economy. Those are three very powerful words that strike fear in the hearts of many, many people. But it's incredibly important that we are proactive in saying that what we propose will not kill the economy, but rather it will invent a better, healthier, and more prosperous economy. We're creating a better, more prosperous, healthier economy. And that's the way we fight back on this incredibly powerful dragon of inaction that what we're proposing is dangerous.
Wonderful, thanks, Ed, and thanks to the questioner for opening up that important discussion on the economy. It strikes me that I believe it's now, I understand there's an election going on in the US. It's about, I think it's now 30 years, Bill, 30 years down the line, it's pretty clear we have the stupid economy. That, as Ed has just said, that soundbite that climate action will kill the economy doesn't even make sense on its own terms. If we're spending $400 billion directly in subsidizing fossil fuels, and the IMF reckons we're spending $11 million a minute if you take into account the health externalities. So the way that I usually counter this in discussions in the UK is my mum pays tax in the UK. I say, why are you spending my mum's taxes in order to pollute the planet and effectively to burn that money? I think we do have to counter that argument. And again, the health valuation weighs very heavily in that argument, and we should be emphasizing it. We should be emphasizing it through, we should be getting better evidence, we should be summarizing that better, but also communicating it better. So it's a really important point. So I'll just quickly turn to panelists in the room if you'd like to make any quick comments.
Yeah, thanks for your question about healthy economies. Some of you know I ran a political campaign a couple of years ago, and that was really the focus of it. I think that if we can start to move towards an economy based around well-being, everything starts to point in the same direction. I was just reading some just transition materials from a health perspective, and we can talk about equity, we can talk about access, we can talk economy centered around human health and well-being. It all just falls into place. And so I think we're at the time now where, I love the donut economics model. Kate Rayworth, who I had the honor of meeting recently, her model is that we need to make sure that we achieve the social needs of people while not exceeding the planetary boundaries that underpin our entire economy and health systems. And that she is agnostic about growth, because some elements of our economy we do want to grow, but some we really don't. We definitely don't want to start spending more on disaster cleanup that we could otherwise have prevented. And so I think we need to make more buddies in economics. We need to see how the health voice can create the space for them to advance change in a discipline that has its own academics who have made their living doing things a certain way. It's always hard to change things. And so I'm quite curious to see how the health voice can pull at the hearts of people to help economists, again, see if they can start to become planetary healers just the same way we are all learning to be.
Wonderful. Thank you. I haven't been a brilliant timekeeper. We've run about to the part of this that I've been dreading the most, which is to try and sum up that discussion that we've just had over the past hour and a bit. I actually think it can't be done because I think we've touched on too much. We've touched on the evidence for effective communication. We've touched on the power of art. We've touched on scaring people. We've touched on positive stories. We've touched on trusted voices. We've touched on the need to not shortchange this, to not to underestimate the amount of investment we should be making in communication, because there's no point gathering the evidence and doing the work if you don't translate that into action. So that's in fact the final message I was going to leave you with, is that it is going to take all of those things. As WHO, we're a normative agency. We try and standardize everything and try and put things into boxes. I don't think that works for this. I think we have a few simple rules we have a North Star, which is better, healthier, cleaner planet, which also saves you money and just makes everybody's life better. We know the target. We know it's a positive thing. We've got some sort of guidance, some rules on things like simple messages in the right language, communicated repeatedly by a variety of trusted messengers, and using that trusted voice. And then with those, I think we need the diversity. And so the final image, or the phrase that was coming into my head was "let 1,000 flowers bloom." It's not something that we're going to be doing. It's not a disease with a particular intervention. It is something where we're all going to have to tell our own stories in our way with that kind of guidance behind us. So I'd just like to thank you very much. Thank the amazing team who'd organised that, who are sitting in the back room like an art display of people working hard in an aquarium. Also the people who've done a great job of facilitating connection, so on. The amazing panelists, but also thanks to